Let's look at a patient in her 20s with headache. Recently, we have a very common diagnosis called Idiopathic Intracranial Hypertension, or IIH. So I just want to show you guys a common manifestations or MR imaging findings on this entity. So if you look at this T2 sequence, basically, if we look at the orbit very carefully, we see there is some flattening of the posterior sclera bilaterally. You see that this posterior sclera is flattened, and there is some optic nerve head protrusion through the posterior optic disc. As you see here, there is like some bumping over here, so increase the vertical tortuosity of the optic nerve. We see these are like a little bit kinking, and also CSF space around them looks like a little bit more prominent. So these are all signs of intracranial hypertension because of all these like CSF, bulging, papilla edema, and all stuff related to orbits. So we see these partially empty cella, increased CSF spaces over here, and also we see the Meckel's cave enlargement in the right side compared to the left. So this is just a regular smaller one on the left, but we see enlargement of the Meckel's cave on the right. So on this T2 cube sagittal, we again see partially empty cella that I already showed you on axial. So the partially empty appearance in a patient with like around 20s is just not very normal finding. We see cerebellar ectopia. You see that this cerebellar tonsils herniating through the foramen magnum, and basically this is cerebellar tonsillar ectopia, which is acquired in these patients with IIH. When we look at the ventricular system, there is just a slit-like appearance. You see that the third ventricle is barely seen. So this is another signs of intracranial hypertension. And one of the most important imaging findings that we all need to be aware is venous sinus stenosis. So basically, this is an MRV time of flight technique. So without contrast, and you see there is severe stenosis of the distal transverse sinus, and also transverse sigmoid junction bilaterally. It's just worse on the other side. So basically, this is one of the most specific imaging findings for IIH. So when I see this one, I'm just more confident to call it IIH. And they can do venous stenting when it is severe, such as this case, and then it can cause some relief for the patient's headache and other symptoms that they might experience. So just remember, systematic approach for IIH, go to the cerebral tonsils, ventricular system, orbits, extra-axial CSF spaces like Meckel's cave, and also the most important findings are venous sinus stenosis and MRV.